Good evening, I am Dr. Major Manoj Kumar Gupta, EX.JOINT Director, Uttarakhand Government, India. We can end the TB because latent tuberculosis infection is preventable and curable. So, what is the tuberculosis and what is the latent tuberculosis infection? And why latent tuberculosis infection is so important? So, tuberculosis is a contagious disease. In fact, it is so infectious that a person can spread it through air by something as simple as spitting, sneezing, speaking, singing. And if pneumonia like illness has prolonged for longer than 3 weeks, or any respiratory illness in otherwise a healthy person doesn't respond to the regular antibiotics, we should suspect tuberculosis. What are the symptoms of tuberculosis? You may have prolonged productive cough, longer than 3 weeks or more, chest pain or hemoptysis. Second thing, there may be systemic symptoms like low grade remittent fever, chill, night sweats, loss of appetite, easy fatigability, or production of the sputum that starts out mucoid and then become purulent. And most important is loss of weight. And this last symptom of loss of weight is so prominent that it gave tuberculosis its historic name of consumption. So, how do we make the tuberculosis? We just confirm it by a clinical specimen like sputum or aspiration taken from a patient. So, if it is positive, we see the Mycobacterium tuberculosis bacilli, then it is confirmatory. But now, when we got IGRA, and in America we have got QUANTIFERON tuberculosis gold test, then it is very easy to diagnose tuberculosis very early, and treatment is very effective if given complete. So what is the latent tuberculosis infection? If a patient breathes in TB germs and get infected, the body is able to fight the TB germs stopping their growing. So TB germs become inactive in the body, but they are alive. And the numbers of TB germs are very small because they are kept controlled by the body's immune system. So they can wake up and become active later at some time in the life. And these patients, they occur TB germs in the body, but they don't have any symptoms, they don't feel sick, they are not infectious, so they can't spread TB germs to others. Only thing, they have positive TST, tuberculin skin test, positive, or QUANTIFERON TB Gold test positive. That is why if anybody is coming to United States from the India or some other countries where it is endemic, so they get tested by the QUANTIFERON-TB Gold test to see whether he has got exposure of tuberculosis, and if it is they have exposed, so they can be treated, because treatment is very simple and very short. The treatment of latent tuberculosis infection is that children over 2 years can be treated for the latent tuberculosis infection with once weekly RIFAPENTINE and ISONIAZID for 12 weeks, only 12 courses in the 3 months, or alternatively RIFAPENTINE daily for 4 months, or gold standard test 9 months of daily INH. So these tests are equally acceptable, but health providers should consider the shortest treatment regime, as the patients are likely to complete the shorter treatment regime easily and effectively. So how do we diagnose the tuberculosis or confirm it? By means of sign. In science, when we put the stethoscope, then we can get the crepitation of tuberculosis, or we can get high ESR because the fibrinogen and globulin is increased, or chest x-ray to see the cavity or CT scan. But क्या चल रहा है? हिंदुस्तान में CB नाट और अमेरिका में IGRA. When we have CB नाट test, what is CB नाट? CB नाट is fully automated diagnostic test for simultaneous rapid tuberculosis diagnosis and antibiotic sensitive test. It detects the Mycobacterium tuberculosis DNA and resistance to rifampicin test in less than 2 hours. In comparison, the standard culture can take 2 to 6 weeks for Mycobacterium tuberculosis to grow, and conventional drug resistance test can add 3 more weeks. Moreover, it is like RT-PCR test, gives accurate results within 35 to 45 minutes for both COVID-19 and tuberculosis. You put the specimen, sputum or aspiration, clinical specimen taken from the patient into the machine and get the result, because it could works automatically. So when we have CB NAT here, so early diagnosis is there. So why the TB is still going on? Because most of the countries it occurs more in the Southeast Asia, 44%, Africa 24%, and Western Pacific regions 18%. And 50% of the cases in the world are found in these 8 countries: India, Indonesia, China, Pakistan, Bangladesh, Nigeria, Philippines. So, and in 2018, 1/4 of the world's population was thought to have latent tuberculosis infection. And in 2020, an estimated 10 million people diagnosed active tuberculosis, resulting 1.5 million deaths in a year, making it second leading cause of death from an infectious disease after COVID-19. So, early diagnosis and treatment of latent tuberculosis infection is very much important to control the disease. And when there is no symptom in the latent tuberculosis and chest X-ray is negative, sputum negative, then how could we diagnose latent tuberculosis infection? Because 10 to 15% of patients can develop active tuberculosis at some time in later life. There is a gold standard test as a boon, QUANTIFERON-TB Gold IT in tube test. It is a 3rd generation test, and in US CDC in 2002, the QUANTIFERON-TB Gold test was approved by the FDA as an aid in detecting the Mycobacterium tuberculosis infection, mainly latent tuberculosis infection, as it measures the component of cellular mediated reactivity of Mycobacterium tuberculosis bacteria. So it is very simple to treat the latent tuberculosis infection. And if we talk about active tuberculosis infection,